What up, guys? Kamikaze here, and I am sorry for the week-long break, but I had to. I was getting way too much stressed out, and I don't know who I'm talking to since nobody actually watches my videos, but I will continue to make videos because this is what brings me joy. This actually, needless to say, brings down my stress level, and God knows I have a lot of stress. So, if you guys do enjoy this video, please like, favorite, and subscribe. Today, we are going to do a C-section. I would do a natural birth, but I don't have the editing software to block out the vajayjay. So, this is what you get, okay?
Welcome to Surgery Squad's virtual cesarean section. I'm Dr. Jeff, and I'll be guiding you through this surgery today. A cesarean section, commonly referred to as a C-section, is an inpatient procedure where a surgeon makes incisions in a woman's abdomen and uterus to deliver a baby. This procedure is often performed when a physician determines it to be a safer delivery option for the mother, baby, or both. As with any surgery, the use of alcohol and tobacco increases the time it takes to recover, and if the mother has used alcohol or tobacco products during her pregnancy, it can also cause serious birth defects. Our patient today is in her early 30s and is relatively healthy, with exception of a brief history of high blood pressure. Luckily for us, we get the opportunity to deliver her first baby. Now that we've covered the basics, let's scrub in. We'll begin the procedure by inserting an IV into our patient's hand so that we can provide her with any medication and fluids she may need. I've already tied a tourniquet on the patient's upper arm. Can you find a suitable vein in the patient's hand?
Nope, I don't see one. Do you guys see one? No? Me neither.
Looks good to me. Next, we need to sterilize the insertion area using an alcohol wipe.
That's great. We're wasting all this time on shit that should have already been done. Already been done. That's fucking 2 minutes of this video just... Oh, goddamn. I'm done.
Now that the area is disinfected, it's time to insert the needle and advance the angiocatheter into the vein. Take a stab at it.
I'm gonna click and not look because I really fucking hate needles.
The small burst of blood that you just saw in the angiocatheter hub is known as a flashback. This lets us know that the angiocatheter is correctly positioned in the vein. Now I'll release the tourniquet. While applying gentle pressure over the vein to collapse it, you can remove the needle. This will reduce the amount of blood that may pour out of the angiocatheter while the needle is removed. Once you remove the needle, I'll properly dispose of it in a sharps container. I'll lock the IV tubing to the angiocatheter by rotating the locking mechanism. And finally, we need to secure the IV with tape and test the IV line. Excellent job. Was it easier than you thought it would be? In order to reduce the amount of discomfort our patient may have, we'll be giving her a spinal anesthesia. This differs from an epidural in that we'll be injecting the anesthetic directly into the spinal fluid that surrounds the spinal cord. And there's no catheter involved. First, clean the area using iodine-based antiseptic solution.
And done.
Next, we'll inject a local anesthetic to decrease the pain the patient will feel when we inject the spinal anesthetic.
Oh, fuck. Great. More fucking news. Yeah, I asked for it by clicking on this fucking video. I just fucking asked for it. Excuse me.
So far, so good. Now we need to inject the spinal anesthetic directly into the patient's spine.
Oh, great! That's just fucking great.
Now just place a bandage over the injection site and we'll move on. Great. Before we can make any incisions, we need to clean the patient's abdomen with an antimicrobial iodine solution.
done.
Now use the scalpel to make the abdominal incisions. As the incisions are made, you'll need to separate the layers of tissue, fat, and muscle. Are you ready?
Fucking cut. God damn it. God damn it. Why? Why did I click on this one? Why did I think this one would be a good idea? Why the fuck would I think that? I'm a fucking idiot.
It's getting a little messy in there. Use the suction to clear out some of the excess blood and fluid. Insert the retractor to push down the patient's bladder.
Great, we done? We done? Oh shit. Oh, say, can you see what the fuck? Oh god, what the fuck? I see the head, I think. No, that's the placenta, I think. Oh great. That's great. Can we continue now? So I can get this video over with.
Make an incision into the patient's uterus so that we can begin the delivery. Be careful though, we don't want to accidentally injure the baby.
Where am I? Come on. Oh, that's great. That's great. This is really fucking great. I'm so glad I clicked on this. I never regret.
We're almost there.
Clicking on this.
Sometimes a surgeon will need to use forceps to help the baby out, but not in this case. The next step is to apply pressure around the baby's head to assist us in removing the baby from the uterus.
Oh great, it is squishing out. Yeah, that's amazing. Good thing I did not eat anything.
Before we completely remove the baby from the uterus, use the suction bulb to suction fluids from the baby's nose and mouth.
You just like really shoved that down the baby's throat though. You're not gonna clean it off? Okay, you're using different ones.
Now, let's have a baby. Help me remove the baby from the uterus.
No, thank you, sir.
Excellent.
I don't think of you that way at all. Shut the hell up. Goddamn. Coming out the womb, I tell it to shut the hell up. Grade A parenting. Can we cut? Just like, why do they have to clamp it?
Excellent, but we're not done yet. Clamp and cut the baby's umbilical cord in order to detach it from the placenta.
And that's how babies are born. I will see you guys in our next heroic episode. Bye.